All right, welcome to our presentation. So our subject is on hemoglobin A1c and exercise. No, sorry, I'm not that early. But yeah, we've already introduced ourselves, so we can get it going. Just by way of introduction, the reason why hemoglobin A1c, or this is what hemoglobin A1c helps out with, is the disease diabetes. And what we know is that everyone knows really is that diabetes is a metabolic disease that causes the body to have issues producing any or enough insulin in order to utilize glucose. And just from a census that we were able to find, and then from the year 2010 to 2012, the diabetic population actually shot up 10%. That it was, so now it is around 10% of the U.S. population. So as we can see here, it was 25.8 million. Now, in 2012, it's 29.1 million Americans. So it is a growing epidemic, so it's important to know about.
Continuing on what Colton said, so diabetes, since there's not enough insulin or our cells don't respond to the insulin the way they should, it tends to create a chronic high blood sugar, which means you have a lot of glucose in your blood. And we also have hemoglobin in our blood, which most of you probably know that hemoglobin is what helps carry oxygen in the blood, and it is carried in the red blood cells. And hemoglobin can become bound to glucose. And that's what this is showing right now. It's right here. It's a hemoglobin molecule bound to a glucose molecule. And the higher your blood sugar is, the more hemoglobin that is bound to glucose. The lower it is, the less hemoglobin that's bound to glucose. So you're going to see percentages throughout our presentation showing what percentage of hemoglobin are bound to the glucose, and they use that value to decide if you are diabetic or not. They used to measure your blood sugar, and if you had high blood sugar, then they say, okay, well, you might be diabetic. But it's really hard to use blood sugar to decide if you are diabetic or not, because one, you have to have the patient fasting, and two, blood sugar levels go up and down so much. But the binding of glucose to hemoglobin is kind of a slow process, and so by measuring the percent of hemoglobin that are bound to glucose, it gives you a more average percentage, or a more average blood glucose level. And so it's a better way of diagnosing diabetes. And so really fast, just so everybody kind of understands, I didn't know how to put this in a slide, so I'm just going to hurry and kind of put it on the board. So if you have a 10% HbA1c, hemoglobin A1c level in your blood, A1c, and then you decrease it to 9%, then that means that you decreased from 10 to 9%. So in our slides, you're going to see a 1% decrease, but that 1% decrease is actually a 10% decrease from baseline, if that makes sense, because 1 divided by 10 is 10%. So don't let that confuse you. When we say it's a 1% decrease, it's not a 1% decrease from overall. It's actually a bigger decrease than that. I don't know how to describe that any better, but some of our slides will specify, and we'll specify it as well. If we don't specify, it's this value we're talking about, not the 10% value. So,
going along with the percentages, did I skip one?
this is Kyle.
So we're going to have Kyle explain this one, and then I'll go to the next one.
Yep.
Skip it.
So if any of you are wondering what are my own hemoglobin A1c levels, there's a very important study done by this guy named Dr. Agarwal. And he and his associates took 3,145 participants. And these are just normal people. Some of them are diabetic, some of them aren't. And he had them perform a graded exercise test. And he wanted to see if there's a relationship between, between their VO2 max, which is just their utilization of oxygen, how much oxygen they can utilize while they're exercising. He wanted to see if there's a relationship between their VO2 max and their hemoglobin A1c levels. And what he found is that yes, there most definitely is. I mean, just looking at these values here, subjects who had hemoglobin A1c levels below 5%, so they're in a very good range for blood sugars overall. Only 17.5% of them had a poor VO2 max, and this was qualified as they were below the 20th percentile in their age and gender category for VO2 max. And as you go up, you see that as their hemoglobin A1c levels increase, the percentage of the subjects who were not very fit, they had poor VO2 max, that increased as well. So here in the hemoglobin A1c over 8%, full 43.1% of them also had a poor VO2 max. And the p-value for that was 0.05.
So going along with the percentages, as we go throughout the slides, you guys are going to notice that we have different values. So just so you understand, any value that's between 4% to 5.6% is considered a normal range. That's kind of where we're shooting for as a non-diabetic population. Once you start getting above that, from 5.7 to 6.4, you're considered pre-diabetic, and then anything above 6.5% is considered diabetic. So just keep that in mind as we go through each slide, and you'll notice that it kind of varies between each of the studies that we've done. Going on to this next, the chart, you noticed in the last slide I had greater than 7.5% and less than 7.5%. Up here on top, we've got a study. It's showing those that had values greater than 7.5%. And one thing that I wanted to point out is with those that are greater than 7.5%, all of the exercises listed here, so we've got combined, aerobic, and resistance, they've all got p-values that are significant. So the drops, there's significant drops that we're going to talk about later associated with each of the exercises. But notice that all of these exercises have significant drops based on their p-value. As we drop back down below 7.5, so this is where you're getting closer to your pre-diabetic and non-diabetic stages. The only one that has a consistent p-value with a significant value is the combined exercise group. So that's one thing that we're going to focus on throughout our presentation, is that combined exercise is our recommendation, and we'll explain it more as we go through the slides as well. So just something to keep in mind here.
Going off of what Dylan was talking about, we wanted to kind of combine our data from our different studies and see how the baseline hemoglobin levels that people had affected their ability to decrease their hemoglobin levels. And so we took lots of studies. A lot of our studies were 3 months to 6 months. Well, we're either 3 months or we're either 6 months. And so what we did here is we took the 3-month studies that did combined exercise, and we put them on a graph with the x-axis being their baseline hemoglobin levels. So 8 represents that these people had hemoglobin levels of 8.
Hemoglobin A1c?
Hemoglobin A1c, sorry. And then the y-axis shows the decrease in hemoglobin A1c that they had. And so as you see, in both 3 months and the 6 months for the combined, and for resistance, and for aerobic, which is going to be on the next slide, all of them had bigger decreases the higher baseline hemoglobin A1c you had. Which means if you have a high baseline hemoglobin A1c level, it's going to be a lot easier to lower it than if you don't. And you see that across the board with a lot of studies, different durations. And so this is just a chart of the studies that we used to extract data. Not all of these studies were used because not all of them were 3 months and 6 months. Some of them were 4 months, some of them were 9 months. And some of them didn't really fit the criteria that we were looking for. And so we kind of separated them out and used the ones that we thought fit our criteria. And so orange, they didn't really have significant values given, so we don't know if there was significance. And then the ones with stars, these ones are the ones that are significant. You'll see in the combined exercise group, all of them are significant. In the aerobic and resistance, a lot of them are significant, but not as many, which once again helps us see that combined exercise is the best way to reduce your hemoglobin A1c levels.
And then it's just continuing on with those charts as well.
So yeah, as was previously mentioned, we studied different modes of exercise. Just to reiterate, resistance training, aerobic exercises that include walking and yoga. We're going to take the time just to kind of break those down individually a little bit more with the studies that we read. So yoga, Just for full disclosure, we know, to quote Brother Langford, that yoga practitioners can be a little fruity. So in the studies that we actually read, diet wasn't altered at all, and these were people who hadn't been practicing yoga their entire lives, but rather people who were introduced to a new yoga program and then saw the benefits from it. So Hunter and her associates were involved in a study involving something called Hatha Yoga, which is a type of yoga that involves different types of poses. And during this study, she took 34 participants, split them directly in half, so 17 in each, had one group practice yoga for 3 months, and the other group was the control group, just didn't really change anything. Just so you know, like, what the yoga things they practiced. Right here is just kind of a little rundown of what they did each day. It's about an hour of yoga for 3 days a week. Okay, and so what happened with that, hemoglobin was shown to be lowered in that study, and it was a significant change. It was a p-value of 0.05. I'll show it on the next chart. But then another study was conducted by Hunter involving a different group of people, because she wanted to kind of, or her and her colleagues wanted to get more into, now, does everybody change? Because for the first group, it was more of like an obese population or more overweight population. So what she did was she took young adults between 18 and 25 with BMIs, lean BMIs, and then for obese seniors, so anyone with a BMI over 30 and over the age of 60. And what they saw in that study was that the obese seniors did see a drastic decrease in their hemoglobin A1c, while the lean, more fit young adults did not see a significant change. Again, like was mentioned, diet was not changed for neither group nor neither of the studies. And just what these studies have shown, that there is like an outside influence on hemoglobin A1c more than just what you put in. So this next one shows the charts. So yeah, so this is where the baseline, the hemoglobin A1c started for the Bikram study. We saw that drop from around 7.4 to 7.2 over the course of 8 weeks. And then for the Hatha study, that was the first one that was conducted, was a 7.4 to 7.0. I mean 7.5 to 7.2, my bad. But yeah, again, 3 times a week for 1 hour each. Okay, and then this next one was the psychological or psychosocial effects on hemoglobin A1c, another study that we read. It was conducted involving 60 elderly patients living in the same retirement home. So the reason why we did this one is kind of we're interested in seeing like if it was, because yoga, you know, they kind of create that environment of like the tranquility. Kind of wanted to see if that was an effect at all as to why the hemoglobin was able to drop. So what they did with these 60 elderly patients, they split them into the 30 to 2 groups of 30, where one of the participants was a social group and the other one was just a control group and did the normal things that they do in the retirement center. And what they did for the social group is the way they explained it is they increased their social activities by 3-fold. So they would have, the tenants were talking to them a lot more, interacting with them. They played games together. They had social events like dances they mentioned. And then they'd go on group walks. They didn't specify how long the walks were, but they did stuff with groups. And there's more for interaction. The results after 6 months, as we can see, they started around an 8.1 hemoglobin A1c and then dropped to 7.6. The social group alone did. So the results and the p-value for that was a 0.02 over 6 months, so it was a significant study.
Okay, walking. Now walking is very simple. I guess we all do it. I encourage everyone after being here for 4 hours, let's do some walking. It's very simple, it's very safe. It's convenient for any individual to perform. Studies have proven to have hemoglobin A1c, to reduce hemoglobin A1c and risk factors for diabetes. I focus on 2 studies, Walker and Sons and their associates, just to see what are the effects walking can have with hemoglobin A1c. Walker, a little bit about this study. It was 31 participants, they were women. They were between 50 to 60. One group, 11 of them had type 2, 20 were non-diabetic, so they were in the normal range as what we were looking at the baselines. It was self-paced, so they walked at their own pace. It was 1 hour per day, 5 days a week for 3 months. And the way they tested, before they actually had the walking program, they had them test a 1.6 kilometer, which is like almost a mile, of a walking test, took their time, then they had the program. After 3 months, they did again the test, 1.6 kilometers. There were BMIs between 29 to 30, so a little bit overweight and obese, and these were a little bit of the results. So their time from in the beginning was like around 18 minutes, and then for the non-diabetics, excuse me, and then the final they decreased their time after that, this walking program. For women that had type 2 diabetes, they started at 18.4 minutes, and then final was 16.9 minutes. And also another indication, their VO2 max increased 20.7 to 25.7, and for the women with type 2 diabetes, 18.7 to 21.8. So it goes along with what Kai was saying, like when you improve your VO2 max, there should be an improvement with hemoglobin A1c. And then this next chart right here, these were the results. For the non-diabetic population, they started at 5.58, so they were non-diabetic, as I was saying, and they did see a decrease of 5.38 their level. And
To 5.38.
5.
Not all 5.3 though.
No, see a decrease too. And then women with type 2 diabetes, 7.